video, I'll see what it is.
Do you know? Just point it to the video. Just point the...
She was just life and soul at party, really.
Yeah, she was.
Everywhere she went, everybody loved her.
You know, everybody knew my mum.
Jeanette and Lisa often talk about their mum Rita like somebody they used to know. Not because she's no longer here, but because they're grieving for the person she was before a dementia diagnosis.
When her illness worsened, they were advised to place her in a care home between 2021 and 2023.
Every time I went, my mum would wet through and we were having to ask them to change her. That's why my mum got put in this place, to be cared for, to be looked after, to be clean and dry.
She was also often left in this position, her head hanging low, neck unsupported.
Just on a dining chair, sort of more or less either with her head on the table or more or less just folded in half.
There were two carers walking in and out, looking at her like that. But they just didn't seem to, they weren't bothered at all.
Rita also had a number of unwitnessed falls, resulting in these injuries and adding to her daughter's concerns for her well-being.
Rita was staying at Abbey Grange Care Home in Sheffield. The Care Quality Commission inspected the home on 20th July 2022 in response to specific concerns raised to them. Country Court, the company that runs the home, decided not to comment on all the allegations in this report. After this inspection, the home remained rated good overall, with the CQC concluding staff there understood how to protect people from harm.
We noticed when we went to visit, he was always in dirty clothes.
Another family who had loved ones at the same home between 2022 and 2023, with their own allegations of how his care was neglected.
We started to notice that the poo was dried on. So when we tried to clean my dad, it was hurting him, he was in pain, and we had trouble wiping the poo away because it was that dried on. He must have been sat in that for a long time for it to get like that. Why is he sat like this? This can't be normal, this can't be right.
This family feels staff at the home were poorly equipped to deal with the needs of the people they were looking after.
I feel that they're not trained enough how to deal with dementia, how to talk to them, how to reassure them, how to make their life a little bit better.
They also say he had frequent falls, some of which they wouldn't be told about.
Some that they used to contact us about, but a lot they didn't.
And it would literally be the next time we visited him, noticing that he's got a bruise or a gash on his head or something like that.
And he used to say, I'm trapped here. I'm trapped. I do believe if we'd have got him out of there into probably the one that he passed away at, he'd have had more happier days and maybe he would have lived a bit longer. We'd have had him a bit longer.
Those issues go beyond just this home. Sky News has found that there is no mandatory dementia training for people applying to work in care homes. We put this to the Alzheimer Society, who told us thousands of people are being let down by a system that needs better investment. They told us dementia is the UK's biggest killer. There are 900,000 people living with dementia in the UK, and although the majority of people who draw on adult social care have dementia, the social care system is not currently set up to properly meet their needs. Care staff need training that enables them to understand the challenges people with dementia can face and to learn skills that can support effective communication. We've also spoken to one person who between 2022 and 2023 worked at Abbey Grange. They also believe so many of the alleged issues at the home stem from poor training.
And it's only because you'd watch other staff and you'd pick it up that way. You don't have no moving and handling experience. There's certain ways you can pick them up, lift them and help them and stuff, support them. You don't get that. So if I'd have gone in and just basically rolled a lady over who'd got fragile skin, I could have tore her skin. If I'd have gone and tried to help a lady out of bed and she'd fallen, that would be my fault because I've not done moving and handling, but they'd make me do it.
This ex-member of staff also says hygiene was an issue at Abbey Grange, sometimes with severe consequences, alleging one resident died after an open wound became infected.
So I'd put down that this lady had got this bed sore and it was non-blanching.
What does that mean?
That means there's no blood supply going to it, it's dying off. But because I wasn't there with her for the next 4 or 5 shifts, when I went back to this bed sore, it broke open. They were telling seniors and nurses, make sure this happens and that happens, but they weren't relaying it to us. But then we won't see this lady for 4 or 5 shifts, so there's no continuity there, and that sore, it just got bigger and bigger. And it got as though you walked onto the unit and the first thing you could smell was this lady's leg.
We've been speaking to the Department of Health and Social Care about the issues we've uncovered. It said all dementia care staff should be receiving training that the government has delivered in collaboration with the care sector. The department also said that all care providers should be carrying out checks on the competence and skill of their staff.
Happy birthday to you.
In November of last year, Rita moved into a new home, where she celebrated her 77th birthday. Her family say she's healthier and happier, but they are still angry at her home and the system, which they believe cost her 18 months of her life. Shingi Marike, Sky News.